Okay, train and chat. Welcome. So, in this episode, I'm going to take you through a full dynamic warm up for my lower body strength and advanced flexibility session. So, I'm training some front splits as well as some lower body strength, very minimal, some Bulgarian split squats, some Nordic curls. And here's just a little warm up I like to do to just prepare my body and not only mobilize, but kind of assess how my body is feeling on the day. How are my joints feeling? Not necessarily in a way that I need to fix anything if I'm feeling excessively sore in an area, but just to take an account when I go into my main work. Maybe I don't want to push something too excessively. I like to use warm-ups as kind of a daily assessment where I take my joints through a full range of motion, not necessarily trying to improve my flexibility, but just scanning in these close to end range positions, how my body's recovering on the day, and then I can make a more accurate decision in how I want to load for some of my main work. So to start off, I always like stretching out my obliques, my QLs, lats, all the muscles that kind of insert the lumbar spine to the pelvis. And it just makes my hips feel much better because if these muscles are really tight, it yanks on the pelvis, so it kind of crowds the space for the femur to move. So this is why when we want to improve our hip mobility, we should also think about the muscles that connect the spine to the pelvis, because the femur articulates on a fixed pelvis when we move an open chain. So I like to do a 90-90 oblique, a side-lying oblique stretch, and a little bit of half kneeling. I call these the half kneeling Jefferson curl, because if you do use these as a main exercise, you can hold a weight. In this case, my right arm can hold a weight and I can kind of bend toward that back foot. If I keep more of an anterior pelvic tilt, then I target more of the obliques. If I keep more of a posterior pelvic tilt, I can target the TFL and the QLs. So to summarize, get the spine moving well and your hips will benefit as well. You know, a lot of strength coaches kind of talk down on warm-ups nowadays, especially on social media, saying, oh, we don't need warm-ups. All you need to do is just get into the main exercise you want to do, and then your ramp-up sets are your warm-up. And I disagree. I think if you could take 5 to 10 minutes to scan the body like this and take note of what joints are feeling excessively stiff, where do you have kind of closing angle pains, are muscles feeling like they're on the verge of being strained just by stretching them, it can prepare you for what's to come in your strength session. Maybe you don't load as heavy that day. If you're feeling great in your warm-up, maybe that's a good sign that you could push things intensely today. It's a good way of just auto-regulating. Plus, I like to use my warm-up as a way of separating my outside world with my workout. So maybe I've just had a full day of seeing clients, I've been at the computer writing programs, maybe I'm a bit stressed with something. You know, I like to just take my warm up to mentally decompress from the outside world and switch on to workout mode. So it's a good way of kind of switching nervous system states, because if you come into the gym very in a sympathetic state, a very upregulated state, then you don't have anywhere to upregulate to. It helps to kind of decompress, get more into a parasympathetic state so that you can upregulate from there. So I was doing some squat to pikes in a lateral fashion, getting into the posterior capsule, getting into the lateral hamstring, which is everyone's tightest hamstring. Now I am working some hip extension. So a really good stretch for the rectus femoris. It looks a little funky, kind of hump in the air. The goal here is to just really squeeze the glutes with a compressed knee. So if you just start doing this, you'll probably not be able to get to neutral hip extension. So I kind of do these knee drops where I'm kind of dynamically stretching, and then from there, I'll just keep the knee down and just actively extend the hip. So everyone's got super tight quads, everyone's got tight hip flexors. It pulls the pelvis anteriorly, and it can even restrict hip flexion because the pelvis is, again, crowding the femur from flexing. So I do find improving hip extension really does improve a lot of other ranges of motion. So in between, I like to reassess the squat, see how that's feeling, keep checking in with it. And I'm just going into some squat internal rotations. Again, not trying to improve anything. I'm not trying to expand the range of my joint capsule and hip rotators with this. I'm just kind of moving dynamically through the range, shaking off the rust, shaking off the stiffness from yesterday's workout, and just preparing the body a bit. This isn't even my flexibility work for the day. This is just the grease the groove type of stuff. So now I like to get into some of my end range activation stuff, especially the stuff that I'm not going to be training specifically today, so I'm not having a huge focus of adductors. I will be doing, of course, the wall kettlebell middle split, which I do twice a week, but I'm just doing some short range contractions, activating the lateral hip, the glutes, a few lift offs, going into a bit of a stretch afterwards. Again, if you had this programmed in, you could do this for multiple sets, 3, even 5 sets. But I'm just doing one set here for a brief warm-up, just getting that stuff fired on the lateral hip. So one of the themes I wanted to talk through today was training through injury. When should we train through pain? When should we rest? When should we back off? How do we do this? How do we restructure a program? And there's 2 camps of people I tend to notice. So the first camp is the very hypersensitive type of person where if they notice any sort of discomfort in their body, they overanalyze it and they automatically think they need to rest, they need to modify their program. Okay, this doesn't feel good. If I keep training through it, I'm going to injure something, so I'm going to stop right away. And then you have the other camp who just basically ignores their pain and they train through it all the time. They basically go until they physically break and they're forced to not train anymore. These are the type of people that are scared they're going to lose their gains if they go off course or lose momentum and they have to train. These are people who invest a lot into their training, whether they're athletes and they have a lot to lose. Now, both of these camps can be very unhealthy. And of course, like everything in training, we have to find a happy medium. And there's instances where I would lean to one side versus the other. Being someone who takes training very seriously, I tend to be in the camp of I just try to ignore things and I train through a lot of different pain conditions, but that's at my detriment as well. If I can go back in time to when I was younger, there are many injuries where I would have seen much better results of getting through faster if I did modify early on and give my body a chance to heal. But unfortunately, this is how you learn how to overcome injuries: is you do things wrong yourself or with patients, with people you work with. Sometimes you flare them up, sometimes they don't get better in an appropriate time frame, and that's what allows you to learn. I don't want to go see the physical therapist that has only successes because I know they're lying. I want to hear the real stories. I want to hear the people they've flared up, the people who didn't get good results, because that is what allows you to actually learn. So let's get into a bit more detail with this. The problem with pain is we never know the root cause. It could be external stressors where it's something in life that's overflowing your cup, your ability to tolerate stress. It could be excess activity where you're not recovering from your training and then a weak or compromised area has flared up. Or it could be a chronic injury that you've been dealing with for years and it's feeling a little bit worse. And it's kind of the principle of damned if you do, damned if you don't. So there's people who take rest, and rest doesn't fix their injuries, and there's people who are able to train through things, and sometimes they end up feeling better from doing that. So I do think it does take some experimentation, but this has more to do with the nature of injury. Okay, so here we go, getting into some specific flexibility work, doing some wall kettlebell middle splits, contract, relax, sliding into a deep range, and then just trying to squeeze my glutes as hard as I can, as if I'm trying to thrust my hips up. You obviously can't see it here. So I'm just kind of doing that for intervals of 10 seconds and then relaxing, trying to go a little bit deeper over the course of, 30 to 60 seconds. So injuries, back to it. If you have an acute strain, an acute tearing, a mechanism of injury where you're in the session, you feel something kind of pop, and then it's really sore after that, I would probably modify in that case. Allow the tissue to heal. Rest is going to be your friend. Now, if you have a chronic issue where rest doesn't help it, you need to build capacity, you need to keep that tissue moving. Maybe if it's a degenerative tendinopathy where these tissues just don't get a lot of blood flow unless you move and you load them, that's going to be more of a case where you should probably train through it. If it's like a bit of impingement, sometimes if you do move through those ranges of motion that are impinged, the blood flow you get with that, the increased range of motion, it can help it feel better. By the way, these liftoffs are absolutely disgusting. So getting into a full long lunge in a wall quad stretch and then trying to pull the foot off while maintaining hip extension, it's a really good way to supercharge your hip flexor and quad stretching. In this case, it's more focused to the hip flexor as we're in this deep level of hip extension. So 3 sets of that, superset with some Jefferson curls in a Zercher position where the barbell is resting on my elbows with a little bit of foot elevation. So moving through the range, not coming all the way up, just kind of articulating at the spine halfway. This is my first set. My knees are having a hard time staying locked, so I have to really focus on that. When I get to the bottom here, notice I shift my hips forward slightly so I get more of a stretch through dorsiflexion. So again, 3 rounds, back to back of these. I'm only going to show 1 round here. So yeah, injuries. Most things that aren't very sinister, something that kind of just comes on gradually. It's a sign that your body is not recovering. So in a lot of instances, a deload can help fix that, where you reduce volume for a week or 2 weeks, and a little bit of modification. So maybe you're reducing overall volume for 4 weeks. It is important to listen to your body in that case, but you should keep training. It's not something where you need to totally avoid movement in that area. It's just, we may need to be a bit cautious about how much volume we're doing. We need to reassess how we're recovering, sleep, nutrition, all that. So that was my front split, by the way. Finished with 5 rounds of contract relax, around 45 to 60 seconds, really emphasizing that glute squeeze of the back leg, trying to pull myself deeper into the stretch. And then now I'm on to some Bulgarian split squats, superset with some Nordic hamstring curls. Yes, I do my strength work after my flexibility. Flexibility is my #1 priority. This block, I am using the Bulgarian split squat as my main exercise. Previous phases was front squats, back squats. Now I'm getting back into more unilateral work as I'm building up the general capacity to get back into some dragon squatting. So I just wanted to demonstrate here real quick how people butcher the Bulgarian split squat by shifting their weight way too far back and their butt moves toward their heels as if they're doing a quad stretch. And then notice how that knee travels backwards and it doesn't stay forward over the toe. Okay, lastly, finished off with some one-arm handstands. This was my best one-arm handstand I think I've ever done, 25 seconds here. So let me know if you like this style of video. You get to see a little bit of my training. I could talk through some things. And let me know in the comments who's mature and who's idiot like old me. Do you prefer training through injuries, or do you rest immediately, or are you smart about things and you keep training and you just modify? All right, that's the video. Let me know in the comments what you want me to talk about next.